It's Melanie from Dr. Lee's office.
Hello.
Good to see you,
Michael.
I know, it's my sister, Marnoosh.
Marnoosh, nice to meet you. How pretty you are.
Thank you.
Yeah, well, thanks for coming in. And Michael, it's been, what, 5 years since we did your nose?
Yeah.
That's great.
You know, since you did a great job on my nose, Marnoosh wanted to do the same.
Thank you. I appreciate that.
I like to bring the tip up.
And take the hump off. And do you want your nose a little bit thinner?
Oh, that would be good.
Okay. And how about the tip? Do you want your tip a little bit more refined?
I really like what you did on him.
It looks good, doesn't it?
Yeah, it's good, that's good.
What I see for you is that we just shape down the back of your nose, maybe about 3 millimeters, and that'll take the hump off the back of your nose. And then we can give you a really cute tip, and that'll match your face really nicely.
I'm excited.
I am too. Yeah.
Thank you, I'm very excited.
All right. Thanks for coming in.
Thank you, Dr. Lee.
Thank you.
You need to see a change. You need to make it. You need to make it.
Hi, you guys. Good afternoon. Today we're going to be doing a rhinoplasty on Marnoosh. This is going to have just such a nice enhancement of an already pretty woman. It's going to be the perfect fit for her face. The upper part of the nose is made of bone, and the bottom half of the nose is made out of cartilage. Let's do this.
Okay.
All right. We're going to first reduce the dorsum, or the back of the nose, to take the hump off the nose. Then we're going to narrow the nose by actually doing a little break of the bone and moving the bones together. And then the third step will be to refine her tip and give her a nice, cute little tip she wants. Okay, here we go. We're gonna make a little incision right here at the bottom of her nose. And through that, we're gonna open up the skin of the nose, kind of like opening up the hood of a car. I'm freeing up the bones now so we can take off that hump on the back of her nose. Gonna debulk the tip a little bit and get rid of some of this extra cartilage. And see that we're starting to get this down. We need a little bit more hump reduction right there. We have to make sure this nose is perfectly smooth. Otherwise, if you feel a bump, it really bothers the patients. Now, Marnoosh did not like the way her nose hung down, so I'm gonna take off some of this cartilage to allow her nose tip to rotate upwards. We're gonna take 3 millimeters off the back and rotate her up about 1.5 millimeters. We're gonna now take out our little piece of cartilage, which we'll use as a graft. Okay, so that graft is about 23 millimeters long. Her nasal tip falls down because there's no tent pole to hold it up. So we're gonna form a cartilage tent pole, or what we call a strut graft, and that'll hold her tip nice and firm and prominent, and it'll actually give her a more defined tip by putting cartilage in there. That looks good. See how the profile's now changed to a little nice, cute tip? Okay, now we're putting the splint on, and we're done with the operation. Marnoosh's operation went really well. We were able to get the hump down, get the bones thin. She has a really cute tip, and we rotated it up just a little bit for her. Good job.
Get it started now.
I noticed.
Hello.
Hi.
Hey, Marnoosh. You look beautiful.
Thank you.
Hey, what do you think so far?
I love it. It's amazing. Most of my friends, they don't even notice. They're like, did you change your hair color? Did you have a haircut? I'm like, no, what do you think? And then when I tell them, they get so surprised.
Is it just right?
It's perfect.
Let me see how it turned out to the side. Let's drop your chin. Oh, that looks really nice. We got rid of this little bump on the side, and we thinned the bones, so your nose is much thinner.
And is it gonna get a little bit smaller?
The swelling just continues to go down. The tip will get thinner.
Right.
And the dorsum here is gonna get thinner. Well, come next door. I wanna show you your pictures.
Sure.
This is before surgery, and this is today.
Oh my God, I almost forgot how I looked before.
We were able to thin this down, and see how much thinner your tip is?
Yeah,
And it's gonna even get thinner.
Wow, look at that.
And what I like about it is when you take the bump off, all of a sudden your eyes will look prettier.
Wow.
It's a wonderful success story.
Thank you. Thank you
You're
so much
welcome.
again. You
You're
made me so
welcome.
happy.
Great to see you. I'll see you in a few months.